Wait 1 second.
Yes, Sambul, health is wealth for sure.
So, welcome to today's session on menopause, navigating your career through menopause and how to do great at it. Today, we have as our speaker Dr. Ameya Kanakya, co founder of ELDAHEALTH, gynecologist, and a menopause specialist with 15 years of experience. In fact, more than 15 years of experience. Dr. Ameya began her private practice in Mumbai in 2013. She experienced a lot of empathy towards her patients who were facing multiple health issues. This drove her towards Elda Health. Elda Health is an integrated digital health platform that understands women intimately to improve their overall wellness. They offer health education to spread awareness and holistic lifestyle interventions for the well being of women. We started our journey by supporting women going through their menopause. So today they are here to offer all of you solutions targeting a broad spectrum of health concerns faced by women on senior career levels. Dr. Ameya believes that it is not always the medicines, but also the compassion you show towards the women you are treating that helps to cure them. She guides women with combined approach of medical interventions and lifestyle management. She also supports young mothers through their pregnancy and post-pregnancy by providing prenatal care and treatment options to tackle postpartum complications. A very warm welcome to you, Dr. Ameya. We're really excited to have you here with us as you are helping us talk about this super interesting topic that and a very vital one that nobody really addresses. So thank you so much for coming on our platform and helping women on our platform deal with their own complications related to menopause.
Thank you, Aditi. Thank you for that lovely introduction, that lovely welcome. And yes, I'm also very excited to be talking about this. And at Edda Health, we have helped a lot of women. We have some 60,000 plus women on our platform. And we've helped a lot of them to navigate all their menopause concerns. And while I talk about menopause and career today, it's great. Even I got to learn and to know a lot of new things while I was actually, researching for this topic. Coincidentally, I was reading a book called Womenomics, which also spoke about this. So that generated a lot of interest in my mind also, where just not just menopause and the health issues about menopause, but how menopause is also so closely related to a woman's career as well. And in today's session, we'll cover all of these issues. We'll not just cover how you can manage your menopause, but I'll also give a brief about what is menopause, why is it so significant, when does it happen, and so on. So while we begin with menopause, we are talking about women and menopause and careers today, because it's been found that a significant proportion of yes, please answer this poll question also. What age does menopause occur at? So let's see what are the answers as well. So a significant proportion of women actually leave their jobs and leave their work at the peak of their careers because of the challenges that they face because of menopause. So let me talk about that. Let me talk about how we can change that scenario, how you can navigate your way around menopause, and still have a great career as well. So let's start with what actually menopause is. And before that, let's actually see what are the different phases of the menstrual cycle, or that whole menstrual journey that a woman goes through. At any point in time, if you want to ask any questions, please type your answers in the chat box so that we can address all those questions towards the end of the webinar. So what is menopause? So menopause is not like just one point in your life. It's a transition. It's a phase which goes on. Your menstrual cycles, which typically begin at menarche, when you start getting your periods, they go on with regular periods for the next 3 decades or so. And finally, it comes to a point wherein you start having certain hormonal fluctuations, because in your normal menstrual cycle, while every month an egg in your ovaries is developing and rupturing, there comes a point where the number of eggs in the ovaries start getting low, start getting depleted, and that is a point in time when you come to your perimenopause time period. This perimenopause is a transition in your menstrual journey, wherein these changes, hormonal changes start. Your periods can become irregular, and you can have the symptoms that you can feel around your menopause as well. Now, this perimenopause can last from maybe even 2 years to up to even 10 years in some women, and then you come to a point of menopause. Again, it's not like a point in your life, but it's a retrospective diagnosis, as we call it. So it's a time when you have not had your periods for the last 12 months, and that's when we say that yes, you finally come to the point of menopause. So no periods for 12 months is when we say that you have achieved your menopause. And that does not come, like this, but it takes a long, that's why we call it the menopause transition. The last and the fourth phase is a time when, you are not, the rest of your life, which you spend without having periods. And when we talk about the awareness regarding all of these things, the awareness of only the first phase, the pre-menopause phase, or the time when you're having regular cycles, that awareness has begun. People have started talking about periods. People have started, buying pads, sanitary napkins openly. People have started talking about period pain, about the choice of taking leaves because of period pain. People are talking about maternity and maternity leaves, and kudos to the Indian government for extending the maternity leave to 6 months. But we have not yet reached that phase of perimenopause, menopause. We have not yet opened up as a society to talking about perimenopause, menopause. In fact, a lot of women do not know what perimenopause exactly is. You've heard of menopause. Yes, their mothers have gone through menopause, their aunts have gone through menopause, their sisters have gone through menopause. But this word perimenopause, in fact, is not known by a lot of women as well. So if they don't know perimenopause, they also do not know what symptoms that they could be facing or they could be up to during this phase. So yes, that's a time. That's the time when we will, this is a time that we have started talking about it, and we should also go ahead and make it like a normal conversation. Just as we're talking about periods, let's also start talking about menopause, because it's a natural phase in your lives. Now, let's hear this TED Talk wherein Andrea Berkowitz, who's the co-founder of ELDAHEALTH and Stella, which is a UK-based menopause care app. Let's hear her talking about menopause. Now, Andrea has worked with McKinsey, and she's also worked with the Melinda and Bill Gates Foundation, and she's now actively working on menopause now. So let's see what she has to say about gender inequity and about menopause.
And of course, there are a number of factors contributing to global gender inequity in the workplace, but I believe that there is one factor often under-recognized, and that's menopause. So what do I mean? Many women will rise into senior positions of leadership in their 40s or their 50s. The average age of a CEO is mid-50s. Perimenopause, or the transition into menopause, generally occurs also between 45 and 55. And this is where the symptoms really start, and it can last up to 10 years. So just as a woman is stepping up, taking the reins, earning at her highest potential, her body can feel like it's betraying her.
So if your body is betraying you, does that mean that there is a pause on your career? Does menopause also mean a pause on your career? Well, let's see. So there are 3 women for every 10 employees in India. And out of these 3, only 1 makes to the leadership team out of 10 is what the research says. And a lot of women who were interviewed have said that 50s has been the most difficult time in their careers. Apart from, if they've managed childbirth, they've managed pregnancies, but yes, 50s has been the most difficult time in their careers. But when we talk about this pause, next slide, Gopika. So when we talk about this pause on a woman's career, is it really the one before, the slide before that? There's one more slide. Well, I'll talk about it. So is that a personal loss? Does it mean that it's a personal loss? Well, no, it's not only you who needs the job. It's not, a lot of research has been done on this, and it's not just you who needs the job, but it's also the organization that needs you. So companies have been, struggling to retain women in leadership positions, have been struggling to retain women who are not older, but who are wiser, who are getting wiser, and they need these women to actually mentor younger women in their companies. So when we talk about the loss because of menopause, it's not really just a loss for you, but it could also be a loss to the company as well. Next slide. So so what does research say? So research, a lot of Gopika, I think there's some issue with the slides. Can I present instead? Just give me a minute. If you can stop sharing, I can start sharing.
Yeah, you can go ahead. Just
you have to stop sharing first.
yeah.
One participant. Yeah. 1 second.
Do you want me to pull out the presentation?
Sorry?
Do you want me to pull out the presentation?
No, I have it.
Okay.
Just give me 1 minute. So I'm just proving that I am a doctor and not a tech person. So please bear with me. It'll take me a minute to understand how to present this. No.
What is the issue, Amaya? What are you looking for?
I can't find the window which we were in on Zoom. 1 second. Can you see my screen?
No, not yet.
No. Maybe Gopika, you can share it with me. I'll try sharing my screen.
I understood. I got it.
Okay.
Okay.
Now can you see the screen?
Yeah, we can.
Yeah, but we are seeing the presenter view, your notes. So
how do I
just can you close the window and then go to present screen?
1 second.
Just select the close the cross button.
How do I stop presenting? Stop share. Okay. Now I'm on the same window. 1 second. Cross. Okay.
Yeah, it's still the presenter view though. So
Yeah. 1 second. Now?
yeah, now it's fine.
Yeah. Yes. Yeah. So studies have been conducted, and these studies have shown. Yeah. So a lot of studies have been conducted by organizations like McKinsey and Columbia University, Goldman Sachs, and they have concluded that having more women at the top positions, at the leadership positions, have improved financial performance of the company in itself. And if women are leaving at the peak of their careers, like I said, it's not just a loss for the woman who's leaving, but also a loss for the organization itself, because it's a loss of knowledge which the woman has accrued for so long. It's a cost in retraining newer employees as well. So yes, it's not just the woman who's losing out if she's leaving her job. Another study which was done by an organization called Catalyst, which studied some Fortune 500 companies, also said that the companies with, I can't see the slides. Yeah, the companies with the highest representation of women in senior management positions perform best, and perform best in terms of finances as well. So is it just, so, like we said, it's like 3 women out of 10 employees who are women. So is it a small number of women? Well, no. If you see the numbers, the numbers are huge. 150 million women in India itself are experiencing or going through menopause right now. And if you look at this global number, the number is 1.2 billion, which is going to be the number by 2025. So it's a huge number of people, huge number of women that we are talking about. And it's not just number of women whom we are talking about, but the loss which has been measured in dollars. So $810 billion are globally spent on things like replacement cost, on retraining employees, and on early retirement and the reduced work hours of these women as well. So what is it? What happens when people are, what happens when women are going through menopause? What are the symptoms that they can face? Yes, stopping periods is just one thing, but is that the only thing? Well, it's not. There are so many things that a woman goes through when we are talking about menopause. So a lot of symptoms that a woman has, which start right from her hair, which go up to her toes. So your hair changes, your hair becomes thinner. There are skin changes, there are palpitations, there is anxiety, you feel tired, there are hot flashes, you gain weight, you can't sleep well, your vagina is dry, you get frequent infections. And it's not just these symptoms, but also other things which affect your health in total. So there are some long-term effects also which you face because of menopause, because your metabolism changes. You have a higher risk of developing diabetes, you have a higher risk of developing heart disease, higher cholesterol levels, high blood pressure levels, your digestion changes, a lot of bloating that you're facing, your bone density, your bones are getting weaker, your muscles are getting weaker. So many things are happening when you're going through menopause. Now let's see what Andrea has to talk again about some studies.
And symptoms can change, so it means you never really know what to expect. But make no mistake, they are significant. So significant that in a study by Vodafone across 5 countries, it found that 60% of women dealing with menopausal symptoms said it impacted their work. In another study in the UK, 30% of women said that they missed work due to their symptoms. And at the extremes, women are making serious choices about their careers. As many as 11% forewent a promotion opportunity, and as many as 8% resigned from their positions because of menopausal symptoms.
So that's a lot of women that we are talking about. So let's talk about what are the symptoms, what are the commonest symptoms that women face in this time, and how we can change that, how we can manage those symptoms at home and at work as well. So let's talk by examples. So let's talk about this one woman, Sanjana. She's 45 years old and she's very competent. She's climbing the corporate ladder. But she suddenly noticed that she started having anxiety and sweating right before a meeting. She used to drive a meeting really well. She used to present really well. But now she finds that, suddenly before a meeting, she's sweating. She's anxious. Is she scared? Well, no, because she's been doing this since donkey years. But she doesn't understand why this anxiety, why that sweating. She's worried about what is happening to her. She's worried about the kind of impression this is going to create. She's worried about what people around her are going to say about it. She's worried because her appraisals are coming up. So what is it? What is it that Sanjana is facing? Yes, what she's facing are what we call as hot flashes. What are hot flashes? Hot flash is a sudden feeling of heat, which sometimes kind of creeps up behind your head or behind your neck, especially in the upper part of your body. There is some people have anxiety or palpitations right before experiencing a hot flash, and you sweat profusely, and sometimes it lasts for a minute, for 5 minutes, maybe for some, and it is often followed by a sudden feeling of chill when you're feeling cold suddenly. People get confused. There are people who have been worried about a hot flash, thinking that, oh, am I getting a heart attack? It is that scary for some women. So why does this happen? It happens because of the lowering estrogen levels in the body. These estrogen levels, this hormone estrogen is like a hero, it affects a lot of organ systems in your body, and it also affects your temperature regulatory system. And because of the fluctuations of this hormone estrogen, you can have these hot flashes. What can you do about it? How can you manage these hot flashes? One thing, a simple thing that you can do, like that lady is having, you can have a fan in your hand. You get those electric fans also these days, rechargeable fans. You can keep a fan handy with you. You can wear, it's good to wear cotton clothes, because cotton absorbs your sweat much better than synthetic clothes. You can also have layered clothing, because if you're working in office, you're going to sometimes feel hot, sometimes feel cold. Temperature regulation has gone for a toss. So maybe you want to wear something and wear a jacket on top, so you can you can remove the jacket if you're feeling very, very hot. Carrying things like hankies, carrying things like wet wipes probably are going to help you. It should be if it is possible, you can, if it is possible for you to manage the room temperature, it's great to do that as well. At home, how do you manage that? Because sometimes these hot flashes can affect you at night, when we call them as night sweats. So sometimes you're sleeping with like a big thick blanket, and you keep on getting up because you're feeling hot and cold alternatively. So taking a thin sheet in bed helps at times. Keeping maybe the fan on, or the window open, or a small table fan close to you, that is also something that can help you. What else can help you is what we call as spaced respiration, which is basically very slow abdominal breathing, when you're taking long breaths and leaving them. Doing this when you have a hot flash helps. Doing this 10 minutes twice a day is also shown to reduce the number of hot flashes that you're facing. Now, what changes can the workplace do to help you feel better when you're going through menopause, or when you're having a hot flash? First of all, people are not aware of it. So people are confused, just as you are confused. People are confused when you are having a hot flash. They also don't know what's happening to this woman over here. So being aware that yes, this is something which can affect you when you're going through menopause, and being able to talk openly about it, being able to say that, okay, I'm getting a hot flash, I need some 5 minutes, and I'll be back. That kind of an open conversation is something which is definitely going to help. An open culture, an open office is something which we very often see these days. But somewhere where there could be ways that you could control the temperature, or a closed room somewhere when the lady can cool off when she's having a hot flash, can definitely help you. Some table fans kept around, some fans kept around can also help her if she's feeling really hot throughout the day. There are women who have to wear a uniform to work, and at such times, some thinner fabric of the uniform has helped them to stay away from the hot flashes as well. Coming to another problem that women very often face, and they find that they've been tolerant so far, but they suddenly get angry these days. They're getting irritable at small things which initially or previously never bothered them. They feel very upset or unhappy about small things that people, their colleagues, or even at their home, their spouses, their children can say to them. There is sudden anxiety about things which initially used to be like very simple and like a breeze. So why does this happen? Why do women face these mood swings? Again, it is your menopause to blame, and it is quite common, very common in fact, to have these mood swings around your menopause. What can you do about it? Again, talk about it. Talk about it to your friend, maybe to your partner, maybe. If it's really bothering you a lot, talk to a psychologist to help understand what's happening. Doing something which you do in your me time, following some kind of hobby by calming your mind. Certain exercises like pranayam, yoga, deep breathing, which will help you to calm yourself down, can help you. Exercise can help you improve your mood by releasing these happy hormones called as endorphins. So yes, exercise, any kind of exercise, not just pranayam or breathing, but any kind of exercise can help you. If you're feeling really sad, upset, anxious, some positive affirmations that you can use, some journaling that you can do, gratitude journaling that you can do, can also help you to overcome these mood swings that you might be having. What can the workplace do to help you get over your mood swings, or get through this phase when you're having your mood swings? Again, be aware of it. Don't just make fun of the person who's having these mood swings. Oh, she keeps on getting angry, usko to gussa aata rehta hai, she's like an atom bomb, or she's like a volcano. don't avoid these microaggressions. The woman it's already going through a lot. These microaggressions are not going to help her. Talk freely about it. Tell her that, yes, I see that you are getting angry. Ask her if she wants to take any kind of help. Ask her if she wants to talk to you. And if you are the person going through that, if it's possible to talk to someone about it freely, it's definitely going to help other people also understand that what you're going through. Take another case. So the second case, Mansi, she's 40 years old and she's been having severe hair fall. She's actually having bald spots on her head also. And she's really worried about it. And her skin doesn't look as it used to. And is this something very superficial? Is this just beauty, which is, just skin deep and you don't have to worry about it? Well, it balding, hair fall, and thinner hair, spots on your skin, it may be superficial for some, but it can be something which can really affect your confidence. We stay in a culture which, all over the world, not just India, but we stay in a culture which gives importance to superficial beauty, which gives importance to being young. So suddenly, when these things start happening to you, yes, it can actually cause a loss of confidence in you. What can you do? First of all, I would say just change the standards of beauty. Just having luscious hair and beautiful skin doesn't mean you're beautiful. Beauty lies somewhere much, much deeper than that. But what can you do to keep your skin better and healthier in this point where you avoid having some acne and infections or dryness on your skin? The three things that dermatologists always say, cleanse your skin, wash your face, moisturize your skin, and always use a sunscreen, even when you're indoors, because we don't go outdoors that much. And we feel that if you're not going out in the sun, we don't need to use the sunscreen. But no, we do need to use the sunscreen even when we're indoors to protect us from the UV light, which also is around us and which also comes from the some of the lights which are indoors as well. So yes, that can help you. Some care for your hair in your me time, maybe oiling your hair or giving you that nice massage is definitely going to help you a little bit in taking your hair, making your hair better. Apart from that, it's very common to have hair fall because of certain deficiencies like iron deficiency or zinc deficiency or vitamin B12 deficiency. So check for those deficiencies. For all you know, that hair loss could just be because your iron levels have been low, and just correcting them can stop that hair loss also. If nothing is helping, or if you're really suffering a lot, please see a doctor, please see a dermatologist, rather than just going online probably and searching for some solutions. A doctor can definitely help you to change this situation. What can you do again at work? Again, avoid those microaggressions, avoid those casual remarks, avoid those casual jokes that very often, we pass on each other, because maybe that woman took those jokes very well a while ago, but now with the phase that she's in, with the loss of confidence that she's feeling, with probably the mood swings also she's going through, it's not going to help. It's not going to help her. Rather than those jokes, ask her if there is any way you can help her to feel better about it. When I saw this picture while making this presentation, I remembered my mom. I was young then, so I didn't know what she was going through. But I remember her keeping the scissors every morning in the fridge, and then we searching for the scissors all over the place. So she used to cut that milk packet with scissors and keep the scissors in the fridge, and she used to forget completely about it. So probably she was going through menopause at that time. What else can happen? Forgetting things, forgetting names. Suddenly you're thinking something and you have a mind fog. You can't think clearly. You can't focus on one thing very clearly. You get tired mentally very often. You are speaking to somebody and you just can't remember. You know the word, but you can't remember the word suddenly. All of these things can happen in menopause, which more so happen towards the late menopause. But yes, this is something which can happen. How can you help it? We have phones. Everyone has phones these days, and everyone has alarms and to-do lists that you can do in the phone. So write things down in the phone, write things down in to-do lists, which you can actually post it here and there on throughout in your office or at your home also, which will help you to remember things. Whatever important things you want to do, please write down those important things. If you're facing this problem, if you know that you're going through it, rather than hiding it from people around you or from your colleagues, talk to them about it, seek help from them, ask them to give you reminders, carry that small diary with you and write down things in that diary. what has shown to help in improving focus and improving this the deteriorating brain function? No medicines, but yes, some challenging puzzles, maybe a sudoku, maybe a a crossword here and there. Such kind of challenging puzzles have been shown to improve your mental capacity. What else has been shown to help is being close to nature, is being close to people as well. So having a lot of people to talk to, having all those social connections has also proven to help you to have a better memory and better understanding. Exercise daily. Exercise is not just for your body, it's also for your mind and for your brain. So releasing those happy hormones and those endorphins has an effect on your mind function, your brain function as well. Shorter working periods, if you're not able to focus for a long time on one thing, what you can follow what is called as a pomodoro method. So have smaller working chunks of 25 to 30 minutes. Work for those 25 minutes and take a break of 5 minutes, come back and work after 25 minutes, take a break of 5 minutes. So this is something which can help you to stay focused on one thing for a completely when you're working on that. How can the workplace again help you? Like I said, rather than hiding these things from your colleagues, talk to them about it, ask them for help, and as a colleague, offer help to that lady. Don't judge her. Oh, you can't remember things. Oh, you keep forgetting things everywhere. Rather than making jokes out of it, it's helping her is actually going to help her solve that problem. It's something that she is going through. Judging her is not going to help either you or her. Let's talk about one more lady. Let's talk about Chaya, who's 53 years old, and she's in a 9 to 5 job, which definitely goes much plus beyond that 5 p.m. Her daughter is in 12th standard, so of course she's definitely stressed because of everything. She feels very tired. She's mentally stressed also, and she's fatigued physically as well. She's unable to sleep because of those anxious thoughts that she keeps on having. She's unable to initiate sleep. She keeps on waking up at night with those anxious thoughts, probably with those night sweats which also bother her at night. So she's tired, fatigued, can't sleep well, and because she cannot sleep well, she keeps on feeling more and more tired day by day. Yes, tiredness, fatigue, mental and physical fatigue, being feeling exhausted is also something that you can face when you're in your menopause, when you're close to your menopause. How can you change it? Women typically are known to do it all, and there are a lot of uh, people around and a lot of things going around which glorify that. Oh, you do everything. Don't do it. It's not going to give you, not going to take you anywhere. Be kind to yourself, delegate that work. You don't have to be everywhere. You don't have to be that Durga with 5 hands and 6 hands and do everything everywhere. Give yourself that me time that you deserve. Give yourself that relaxing time that you deserve. You are not responsible for everything happening around you. Be a little kind to yourself. Take time off for something. Take time off for your exercise, for your meditation. Go and indulge in a spa or a massage at times. It's going to help you. Ask people around you to share the load. It's ask people around you to do things for you. Sometimes people do not really want to hurt you, but they never know that you want them to share the load. So actually speaking to them about it and asking them to help you in certain things is definitely going to help you. And of course, certain vitamin deficiencies, vitamin D deficiency, which is very common these days, can cause tiredness. Vitamin B12 deficiency can cause tiredness. So it's also important to get your vitamins checked to understand where, if there's any deficiency, that can be very easily corrected and you can improve that fatigue that you have been feeling. Something else that we also say is sleep hygiene. If you can't sleep well, first step is not to take medicines for sleeping well, but following a sleep hygiene, which means a kind of a relaxing method that you follow when you're going to sleep. How do you put kids to sleep? You give them a bath, you change their clothes, you read to them, you sing to them. You're a kid. Imagine you're a kid and do that to yourself. You stop looking at the phone before you sleep. Dim the lights before towards night when you're about to sleep. Have some kind of relaxing routine. It could be reading a physical book, it could be taking a shower, it could be having a warm glass of milk, anything that works for you. Follow that sleep hygiene every day. Try to sleep at the same time every night. Try to wake up at the same time every day in the morning. Avoid colas and caffeine and coffee and tea, especially after 4 or 5 p.m. in the evening, if you're not able to sleep well at night. Try to avoid afternoon naps if you're unable to sleep, if you're unable to sleep at night. All of these things can help you to sleep a little better. And yes, insomnia or a sleeplessness is something which very commonly happens to people in menopause. So you're not facing something very, very weird and very different. And medicines may help you, but medicines may not always be necessary for this problem. How can the workplace help you here? Maybe some flexible working hours, if it's possible for your organization to do that. That is something that you can do. And again, just as she can ask, you need to ask for help around your home, and you need to lessen your load. Try to lessen her load at office also. If she's having an issue, if she's going through her menopause, helping her is going to help you and the organization as well. Now, this picture, I don't know how many of you, for how many of you this may be common. This could be something that may be common to all of you towards, especially towards the evening, the swollen feet. When we sit in office, we typically sit with, our feet down. We sit on a chair with our feet let down. And what happens towards your menopause is that, with age or with the lower levels of estrogen in your body, what is happening is that the venous return or the lymphatic return of your legs is slowly getting weaker and weaker. So if you are keeping your legs down, feet down for a long time, there is venous pooling and pooling of lymph towards in your lower limbs, which can cause swelling in your lower limbs. At times, it just could be something which is slightly there, but the swelling can get very troublesome and painful as well if there's a lot of swelling. So this is also something which can happen because of your age or your menopause. What can you do? The correct posture while sitting with, maybe if you could lift your legs up a bit, you can fold your legs and sit, or you can have a small stool or some table that you carry with you, on which you can keep your legs, not keep them slightly elevated. When you're sleeping at night, leg elevation, keeping a pillow below your legs sometimes helps to drain that blood and that lymph back into your circulation. Correct footwear is also something which is very important. A lot of women have to walk a lot, or go around their plant or their office quite a lot when they're working. So yes, a correct footwear over there is really important. And for those women who need to sit in one place and who cannot get up very often, it's important that getting up every now and then and going and walking is going to help you. Your muscles, when you walk, the muscles in your leg contract and relax, and they help to pump the blood back to your heart as well. So that is also something that can help you to reduce the swelling or that edema that is there in your legs. And of course, that age-old method of soaking legs in warm salt water definitely helps you. Let's talk about one more lady. The fourth case, Savita, she's 55, her periods have stopped, and suddenly she has a lot of stiffness in her neck, in her back aches, her neck aches. Now her knees and ankles have also started hurting, and she used to exercise, but because of the pain she feels scared to exercise, so she stopped exercising as well. And she's worried that are my bones getting weaker? Well, yes, menopause does cause your bones to get weaker because the hormone estrogen goes down. Now this hormone estrogen is also responsible for having stronger bones because it helps absorption of calcium in your intestines when you're eating something, and it helps that calcium to go and sit in your bones. Your bones have main two types of cells, ones which are bone building cells and one are bone breaking cells. Now the process of bone breaking is accelerated after the age of 30, and it is accelerated much more around your menopause. So around your menopause, it's very common for your bone mass or your bone density to go down, and because of this your weight has slightly increased, your bones are weaker, your muscles are also weaker, and because of this the brunt of the weight is borne on your knees and ankles, which can also cause your knees and ankles to hurt. What can you do? Of course, exercise. Stopping exercise because of joint pains is not a solution. Exercising correctly, you can talk to your physiotherapist, you can talk to an orthopedician and understand what exercises work for you, what exercises don't work for you. And it's important to keep on exercising to keep your bones stronger. Just having a good intake of calcium is simply not going to help you. It is also important for you to exercise along with taking that good amount of calcium and vitamin D. A little bit of massage of going for some kind of oil rub is going to help you where your knee pain, your leg pain, or your joint pain is concerned. And When we talk about food, yes, it is important for you to have good amount of calcium in your diet. You can have calcium supplements or tablets containing calcium, but your dietary calcium is absorbed the best. And once you have passed the age of menopause, once you're already in menopause, because of low estrogen levels, the calcium absorption is low. So when do you need to take care of your bones? Not after menopause, but way before you actually get menopause. If you're exercising well, if you're eating well, right? Even before you get menopause, yes, that is going to help you to. The bone loss is going to be there, but if you have a good bone mass to begin with, it is going to help you in decreasing the amount of symptoms or the pain that you may have because of this bone loss. What can the workplace do for you again? Posture is something which gives a lot of neck pain to a lot of people these days. So having a good chair to sit on, having, if you're working on your laptops, the laptop should be at your eye level. You should not keep on looking down constantly when you're looking at your laptop. Phones is something, you might have a laptop looking which is here, the desktop which is here, but you're constantly looking on your phone. It's not going to help you. It causes a constant strain on your neck muscles. So changing your posture and having a correct posture is really important for you to get rid of the aches and pains that you have. Sitting constantly in one place, not good. They say sitting is the new smoking. So constantly sitting in one place, not good for you. So taking some frequent breaks, getting up and just walking for a minute or two is definitely something which helps you to decrease the pain and the aches that you can have. Bleeding problems, yes, a lot of women who are going through menopause have a lot of issues where their bleeding is concerned. So some of them have heavy bleeding, some have very frequent bleeding, some have very scanty bleeding, some don't have periods for 2 to 3, 4, 6 months altogether. Now, what is abnormal in this? Having heavy bleeding is abnormal. Spotting or bleeding in between your periods is abnormal, and periods which are very frequently happening every 10 days, every 15 days, that is where you have to be worried about. If the bleeding is scanty, don't worry. If the periods are happening every 3 months, don't worry about that. What is important is when you're losing a lot of blood by heavy frequent bleeding or with continuous spotting. That is when you definitely want to see a doctor, a gynac, and understand why that is happening. Is it simply because of hormonal changes which are happening because of menopause, or is it because of certain other changes like adenomyosis, like a fibroid probably which you might have? It's important to understand why that is happening and treat that problem accordingly. So very commonly we see that people come and they don't know what is heavy. I thought that everybody has heavy bleeding. My body is getting cleansed naturally. I'm going naturally towards menopause. Yes, it's good to be natural. Yes, it's good to let things take the natural course. But if you're bleeding more in your periods, your body is not getting cleansed. Your uterus is not getting cleansed. When you lose more blood, it is your body's blood that you're losing. What is it leading to? It's leading to lower hemoglobin levels. It is leading to a lower immunity level as well. So it is important to talk to your doctor when you're bleeding a lot. Even if you're close to menopause, even if the bleeding is because of hormonal changes of menopause, it is important to rule out the other problems, and it is important to reduce the amount of blood that you have been losing, even if it is a normal or natural or common thing which happens in menopause. Let's talk about one more last case. Shruti, she's 46 years old and she has to travel a lot for her work. And because of that, she needs to use public toilets quite a lot. And she's been getting a lot of infections, urinary infections these days. So what does she do? She says, oh, when I go out, I try to avoid using public toilets. But another problem has come up. She's suffering from urinary urgency, wherein she really is unable to control her urine when she really wants to go. So she's really worried, I don't want to use public toilets because they cause UTI, and I'm having urinary urgency as well. What to do? Now look at this carefully. Public toilets do not cause UTI. What does cause UTI? Not drinking enough water because you're scared of using public toilets when you're traveling. That is what causes UTI. Not using public toilets or not using a toilet and letting the urine accumulate in your bladder for a long time. Anything that stands for a long time, any fluid, liquid inside your body for a longer time, it invites bacteria. Bacteria grow, it starts getting infected. So less going to using the loo less often is what is causing the UTI. Thirdly, what everyone probably does in public toilets, nobody sits down on that public toilet. We are hovering above the seat somewhere, trying to balance ourselves, checking, to see that nothing is touching the public toilet. That, what does that happen? What happens because of that? What happens is that your pelvic floor muscles are not relaxed, so your urine is not completely voided. Some urine stays back in your bladder, and again, something that stays back keeps on getting more and more concentrated, is an invitation for bacteria. So because you're not completely voiding your urine, that is what is actually causing the UTI. So the public toilets are not the reason for your UTI, but lack of not using them or using them incorrectly is what is actually causing the UTIs. If you logically think about it, none of your private parts are actually touching the public toilet when you use it. So how can it cause infection? Don't tell me the bacteria travel behind back in the stream of urine and go back into your urethra. They do not. These are the other things which actually cause these problems. If you're worried about the hygiene of these toilets, what can you do? If there's an Indian squatting toilet available, use that instead. Carry sanitizers with you, sanitize the toilet seat, maybe carry newspapers with you, put the newspaper on that sheet, make a hole in between, and then use the public toilet. But ladies, do not do not avoid using public toilets. It's actually not what is causing your UTI, but not using them is what is causing your UTI. What else can the workplace do? What else can what else can organizations do to ease your menopausal transition? Now, this is a big thing, which is a big what do you say, thing which is happening in UK these days. A lot of people are talking about this. There is a menopause friendly workplace checklist that organizations want to follow to make women feel at ease, to make this transition through menopause easy for women to go through. There are some training and awareness programs. I think more than training, what people need is awareness. They need to understand that yes, these things can happen to women going through menopause, and if they understand that, I'm sure they can be more empathetic towards them. Some kind of support, which is very important, mental health support, is definitely something which organizations are also providing for women who go through who are going through their menopause. Flexible working hours can help. We know you're very busy, so yes, teleconsultations is something which can help. Going to a doctor, waiting in the waiting room, talking to the doctor, you may not have time for all of that, but it is possible for some teleconsultations which can help you to solve your problems. So it's, if these are standards which are now used in the UK, and I'm sure they'll be used in other countries and India as well. Now let's talk a little bit about how do you generally manage menopause, holistically. We saw how we could manage it in the workplace. What else can you do? So we say that there are four pillars, four pillars of lifestyle modifications which can help you to go through menopause easily. One is your nutrition, so eating well, avoiding processed foods, avoiding junk food, eating at correct times, portion control. All of these things help you. Exercise helps you to strengthen your bones. Exercise helps you to improve your bloating, strengthen your muscles, improve your mood, improve your heart health. So many things. Exercise has so many benefits, and it definitely has a great benefit if you're using that as a pillar of modifying your life through menopause. Managing your stress, maybe through meditation, maybe through just one hobby that you're following. Managing your stress by talking to someone, whatever works for you. But managing your stress is really important, because stress is also something which releases, it's not just mental stress releases a hormone called as cortisol, and that causes all these problems, like your anxiety, your heart is affected, your digestion is affected, all of these things are affected. So managing your stress well is very important. The fourth pillar is something which we really undermine, we don't talk about, we don't give importance to, which is sleep. Enough amount of sleep and a good quality of sleep are both what we need to manage through your menopause transition well. So sleeping at the right, I spoke about the sleep hygiene, sleeping at the right time, same time every day, waking up early, avoiding digital distractions and screens before you are sleeping. All of these things help you to sleep well and sleep adequately. So all these four pillars, if managed together, can solve a lot of problems through menopause. And of course, for all these other things that do not help, the doctors are there who can help you understand what is happening and to manage your problems. When do you definitely need to see a doctor? One is a routine screening, so a routine blood test which we advise every year, a pap smear, which is a cervical cancer screening technique which we advise once every 3 years, a self breast examination to be done once every month, and a mammogram after the age of 40, which needs to be done once a year or once in 2 years, are the routine screening methods that you definitely need after the age of 30 or 40. When you have very frequent periods, very frequent bleeding, you need to talk to the doctor. If you have heavy periods, you need to talk to the doctor. If you have stopped having your periods, if you did not have periods for the last 12 months, and now you're having, I'm sorry for the noise, there's some drilling going on over here. If you've stopped having periods and 12 months and then you have your period, which we call as postmenopausal bleeding, yes, that is also something which is a big red flag. You need to see your doctor immediately in such a situation. If you have postcoital bleeding or bleeding after intercourse, yes, it could be something very important, significant. It could be a sign of some kind of atrophy in your vagina, or it could be something which could be a cervical cancer as well, or a lesion on your cervix. So anytime you have bleeding after you've had intercourse, definitely a red flag, definitely need to see your gynac after that. What can a gynac do? What can we do for you? We have various methods of which we can, we have various ways in which we can solve your problems. We can, those methods can be both hormonal as well as non-hormonal. So a lot of non-hormonal medications, herbs are available, which can help you. Some correction of deficiencies can help you. And of course, we also have hormone replacement therapy, which we now call as menopausal hormone therapy. Menopausal hormone therapy is safe to use if it is used correctly in the correctly selected patients. So once we also have a checklist which we check out. If you don't have any of those high risk factors, menopausal hormonal therapy can be very safely used in your case. So, just one quiz or a poll again. So answer this, and we'll talk about this after we have I've answered some of your questions. So please answer this, and I will answer. I mean, look at this after a while. Yes, I think I've covered a lot of things, and I would like to go to your questions and answer them. Before that, what do you, Gopika?
Sure. Thank you, Dr. Ameya, and thanks to all of you for attending this webinar. We apologize for the technical inconvenience in the
I'm so
beginning.
sorry.
Yeah, no worries. But we appreciate your patience. And speaking of menopause, we are hopeful for a future where menopause doesn't put a pause on your career, right? And at ELDA, we offer holistic lifestyle programs to be able to manage menopausal symptoms, metabolic conditions, as well as midlife weight gain. So these programs are holistic in nature and they're online and you can avail them at your convenience. So we're offering exclusive discounts for all of you. So if you'd like to know more about these programs, please feel free to WhatsApp me. I'll share my details on the chat and I'll always be happy to help you out. So yeah, we can proceed to the Q&A then. Looking forward to seeing all your questions.
You could even type the questions and send them anonymously to me as well, so that is also possible. So please go ahead and ask whatever questions you have.
I think we had one question earlier.
Yeah, I'm looking at the questions. Yeah, I'll
Ah.
go through the thing, comments. Yes, one of the best buys for me till date, menstrual cups. Yes, it's life changing, and I also definitely recommend it. It's something it should be definitely used for by everyone. It's good for the environment. It's good for you. It's something because of which you can do everything. You can swim, you can go for hikes, you can do everything with a menstrual cup, and it's definitely safe to use. So please, ladies, go ahead and use the menstrual cup. You're doing yourself and the environment a favor. One question is that can I have hot flashes? Can one have hot flashes as early as late 30s? Yeah, good question, Sumbul. So when the average age of menopause is around 46 years, but like I said, perimenopause can begin even before that. So perimenopause can begin around 4 years or sometimes 10 years before that. So yes, if you are going to have your menopause, and the average is 46, so yes, you can have your menopause at 43, 44, 45 as well. 10 years before that, yes, you can have hot flashes And you can have the symptoms of menopause even or perimenopause even after 35 years of age also. So it is definitely possible to suffer from these symptoms earlier on as well. Even when you're not doing anything, yes, you're doing a favor to yourself by giving yourself me time. And in today's world of a lot of digital distractions, I think this me time is very rare. So it's great if you can actually sit without doing anything these days. I have fibroids of 5 centimeter. Is it a matter of concern? So for fibroids, what we say is, it depends on the size of the fibroid, the position where it is located, and the kind of symptoms it is giving rise to. Anything which is, bigger than this size typically, or which is equal to the size of the uterus, is what we say should be removed ideally. So 5 centimeters probably comes in that area where it is better to remove it. Of course, it's not I cannot comment without seeing you or without actually seeing where exactly the fibroid is or what are the symptoms. But yes, it's if you have a fibroid, it is good to talk to your gynae to understand how it is affecting you, and if it is growing very fast, what is happening with that. And based on these things, we take a decision of whether it needs to be removed or not. Are fungal infections common during menopause? Yes, they are common. There's a question which somebody has asked, which says, are fungal infections common during menopause? Yes, they are. And I'll tell you why. And I think you mean vaginal fungal infections is what I assume. So what happens? Normally a vagina has an acidic pH. And what happens during or towards your menopause is that this pH changes. Why? Because because of lower estrogen levels, the layers of the vagina becomes thinner, the mucosa becomes drier. Because of that, the pH changes from acidic to basic. Now, normally in an acidic pH, we have good bacteria which line the vagina and which prevent other infections from infecting the vagina. But now when that pH turns to basic, these good bacteria cannot survive inside the vagina. They are washed away. And because of these, the other pathogenic or disease causing bacteria and viruses can come and infect the vagina. So yes, this can happen because of vaginal dryness, that you may have frequent fungal vaginal infections as well as frequent urine infections, because the urinary tract mucosa also becomes thinner and drier because of menopause, because of the no effect or the lesser effect of the hormone estrogen. So both these infections, vaginal fungal infections or vaginal infections as well as urinary tract infections, are common around your menopause. So they're common but not normal. So having repeated infections is you need to get yourself evaluated and to understand why that is happening. Again, there are simple methods, some amount of lubrication, vaginal lubricants, which can help you. Some estrogen therapy also can help you. So these things can help you to take care of these infections. I would like to see that poll result, the first and the second poll. Where can I see it? I found it. So at what age does menopause occur is what we asked you first. Well, a lot of people have given the correct answer of 45. So the average age is 45. Menopause can happen anytime. If it happens between the age of 42 to 54 is a normal age of menopause in the Indian population, and the average age is 46 years. The second poll, hormone replacement therapy has many side effects. More people have answered yes than no. Well, so like I said, hormone replacement therapy can be given very, very safely to people after certain things have been ruled out. So if you don't have high blood pressure or uncontrolled high blood pressure, if you don't have liver problems, if you don't have any history of cancers in the family, especially breast cancer in yourself or your mother's side, or if there is no high risk of heart problems in your family, we have this checklist which we go through, and if all of this is correct, we can very, very safely give you hormone therapy. The earlier it is given, the better effect it has on your symptoms, and also on your on the future, on the certain effects like your bone and your heart, which is also affected during menopause. So the earlier it is given, the better it is for these long-term effects also. And the dictum that we use is the smallest possible dose for the shortest possible duration. So if given this way, it can definitely be helpful, and it does not have side effects like we are scared of. It does not cause cancer. In menopause period, as you said, one can have digestive issues. So one should take supplements like calcium and iron, but iron supplements can lead to constipation, etc. too. Yeah. So iron supplements lead to constipation because of the unabsorbed iron in these supplements. So even if you're consuming a supplement, all of that iron does not get absorbed, and because of that, it causes constipation. So it's always good to, of course, if you have low iron levels, we will advise you supplements, but before you reach that stage, it's good to have good iron and calcium through your diet as well. But if if you need to take iron supplements, we advise them to take them with things like, maybe take it with your limbu sharbat, so that it helps vitamin C, helps iron absorption, so that will help iron absorption. Not combining those with things like tea and coffee, which are going to reduce the iron absorption. Not having tea or coffee immediately after meals, because whatever you're eating in your diet will not get absorbed if you're having tea and coffee along with that. So these certain smaller changes in your lifestyle and diet can also help you to have a good iron and calcium consumption. I think I've answered that question. So what happens is with menopause, with lower estrogen levels, the calcium absorption also goes down. So it's good to have calcium, good amount of calcium even before you reach the menopause phase, when you have estrogen levels in your body, good estrogen levels in your body.
Does anyone else have any other questions for Dr. Ameya? All right. Gopika has also dropped in her number for any of you who actually would probably like to know more about the programs that are offered by ELDAHEALTH. So do feel free to reach out to her. We also have a reel series coming up with ELDAHEALTH, wherein we'll be covering various other biological developments that women face that kind of do hamper their careers and how to go about it. Thank you so much, Dr. Ameya, for such an interesting and for deep diving into this topic, and for addressing all the concerns and questions that our audience had. I am sure they are feeling more informed about a situation that is going to happen to, of course, every one of us. So thank you so much for coming onto our platform and for this session. It was truly informative. And yes, thank you so much, Sharon.
All
Thank you
right,
so
bye. Have
much.
a great weekend.
Yes. Bye, everyone. Take care.
Thank you. Yeah, take care.
Thank you. Thanks, Aditi.
Thank you.
Yeah, bye-bye.